We know that Canada has amongst the highest rates of inflammatory bowel disease in the world, and earlier life exposure to the Canadian environment seems to increase your risk of developing inflammatory bowel disease. So the earlier an immigrant arrived to Canada, the higher the risk that they would later develop inflammatory bowel disease, either Crohn's disease or ulcerative colitis. And in fact, when a child was born in Canada to immigrant parents, from certain regions, they actually assume the same high risk of developing inflammatory bowel disease as the children of non-immigrants. So that means that something in the Canadian environment increases your risk of developing IBD, inflammatory bowel disease. Something in the Canadian environment increases your risk of developing inflammatory bowel disease. We know that inflammatory bowel disease is caused by a mix of genetics, and there have been over 160 different genes that predispose people to inflammatory bowel disease. However, the genes only increase your risk a very small amount. So that environmental risk factor, or probably multiple environmental risk factors present in Canada, result in our very high rates of inflammatory bowel disease. The first thing is a cleaner environment, a more hygienic environment, in which we live in more urbanized areas. And that seems to change the immune system in multitude of different immune-mediated diseases, such as inflammatory bowel disease, but also asthma, allergies, multiple sclerosis. So people think that this cleaner environment, while it prolongs life and we live healthier, may increase the risk of some of these immune diseases. In addition, early life antibiotic exposure seems to increase your risk of inflammatory bowel disease. There was a study from Manitoba which showed that being exposed to antibiotics within the first 2 years of life increases your chance of developing Crohn's disease later in life. In addition, other factors such as the method of delivery, so vaginal birth versus cesarean section, as well as living in an urban environment as opposed to living on a farm, seem to increase your risk as well. So we're not honestly very sure. However, some studies have described a north-south gradient, so inflammatory bowel disease is higher in northern nations, and that may relate to vitamin D and sunlight exposure. Some of the genes involved with inflammatory bowel disease also interact with vitamin D in your blood. And so it may be that low levels of vitamin D and low levels of sunlight exposure may be playing a role. However, we're not certain about that. So I think it confirms some things. It confirms that some groups of immigrants seem to have higher risk when they're exposed to the Canadian environment. In particular, there's been a fair amount of literature on people from South Asia, and Canada has a very high rate of immigration from South Asia. But we also, what was surprising is that we also found other regions where the risks seem to go up the earlier in life you were exposed, and those include the Middle East and North Africa and Sub-Saharan Africa as well. On the other hand, we found that people from East Asia, which for Canada immigrants primarily from China and Hong Kong, had very low rates of developing inflammatory bowel disease. We think that the changes that the environment is causing in the body is a change in the microbiome, which is the bacterial composition of bacteria in the intestines. And if we can figure out what those changes are and what's causing them, we could potentially prevent these changes in the bacteria in the intestines by encouraging certain types of foods, certain types of probiotics or prebiotics, or other treatments in that way. In addition, if we can find what change is caused to the immune system through certain types of environmental factors, we could target those changes with medications and either prevent the disease in people who are at high risk or treat the disease better later on. Most importantly is the idea that perhaps we could change these environmental risk factors to prevent the disease in people who are at genetic risk, sort of a personalized medicine approach. And we're a long way off from that, but if we can identify the environmental risk factors that is triggering the disease, then we could hopefully prevent it in people who are at risk. So inflammatory bowel disease is a lifelong condition that affects you from the time of onset until death. The most common time that it comes about is people in their 20s and 30s, so it affects people really in the time of schooling and best productivity to the economy, and can really cause some significant disability. Most strikingly, we're seeing more inflammatory bowel disease in children under 10 years old. That's the fastest growing group in Canada. And in children, it can stunt growth, it can cause osteoporosis later in life, and it can cause all sorts of psychosocial and stresses on the family and on the child.